This Cincy Lifestyle Health segment, sponsored by Mercy Health.
Atrial fibrillation, or AFib, is the most common type of irregular heartbeat that could lead to a stroke. One way to treat it is with cardiac ablation. And Dr. Atari, an electrophysiologist with Mercy Health, explains how a new procedure known as PFA ablation is improving outcomes and overall heart health.
Hi, I'm Mehran Atari. I'm a cardiac electrophysiologist, which basically means that I treat cardiac rhythm problems or abnormal heartbeats. And I have been practicing at Mercy Health since 2018 and primarily work at Mercy Fairfield Hospital. I have been doing ablations and other types of treatments of heart rhythm for more than 20 years. Atrial fibrillation is a very common arrhythmia or very common heart rhythm problems. It affects millions of people in the US, and more than 8% of people above age 80 will develop atrial fibrillation. But it is also very common in middle age and especially patients who have other heart disease. We have been trying to find better ways to treat it. Traditionally, we used to use medications. Over the last 20 years, we have been doing what we call ablation of atrial fibrillation, which basically use the thermal energy to kill the areas of the heart that are causing the atrial fibrillation. PFA, or pulsed field ablation, is the newest technology that is available to ablate the atrial fibrillation. What is different about PFA is how it is killing the tissue. With pulsed field ablation, we send a very high voltage electrical signal into the tissue. What it actually causes is that opens up small areas inside the cells that creates a current of energy inside the cell that basically kills them. And by doing that, we have eliminated the issue of the heat. And why is that important? Because with radiofrequency ablation or cryoablation, by heating or freezing the tissue, we could have some collateral damage. With PFA, it seems that it is much safer. We basically call it more cardioselective, which means that it usually kills more of the heart tissue than any other things. And because of that, we can concentrate on eliminating the areas of the heart that we are interested in ablation of atrial fibrillation without having to worry about causing any collateral damage in the other areas such as esophagus or other structures. PFA is a new technology, and right now it is only geared towards ablation of atrial fibrillation. But a lot of patients that have atrial fibrillation have other arrhythmias as well. So if we see a patient that has multiple different arrhythmias, including atrial fibrillation, we may still use the radiofrequency ablation because that gives us the flexibility to take care of all the different arrhythmias that they have. The good news is that we have PFA ablation available in all our main Mercy hospitals. We are doing it at Mercy West, at Jewish Hospital, at Mercy Anderson, and at Mercy Fairfield. So they are available in all of these hospitals, along with the other modes of ablation that we used to have. You can contact our offices at any of the Mercy hospitals if you are interested in knowing more about AFib in general, or if you are interested in scheduling an ablation or any other type of treatment for your atrial fibrillation. We are providing all the treatments that are helpful to our patients with the newest technology that are out there and have been tested in clinical trials and approved by FDA.